Here to answer your questions about this is Dr. Daniel Koritzkis, Chief of Infectious Diseases at Brigham and Women's Hospital. Thank you so much for being with us.
Well, good evening, Jessica and Ben. Good to be with you.
Thank you, Dr. Koritzkis. We should add that this conclusion from Johns Hopkins University is based on an economic study, not a medical study. I will say our death toll here remains pretty high on a daily basis. Is there anything that public health officials can learn about this study?
I think it's a really fascinating study. I've only had a chance to skim it, but I think there are three things people should keep in mind. One, there are always trade-offs involved between what we hope to achieve in terms of public health and what the economic pain and cost of those interventions might be. Second, it reminds us that when things are honored more in the breach than in the observance, the results are going to be imperfect. And I don't think we could say that our lockdowns were nearly as effective as they could have been had we been much more adherent to the recommendations. And third, if we compare the outcomes in the United States and Europe to countries in Asia, we can see how countries like South Korea, Taiwan, Japan were much more effective. And there was also a study that came out last week in The Lancet that showed that the per capita infection rate or per thousand people was much higher in the United States, where it was in the 500s. This is per 100,000, 500 range, where it was below 100 for most Asian countries and just 3 for New Zealand.
Okay, let me ask you this here. In your experience, what measures work best at keeping patients out of hospitals?
Well, for keeping people out of the hospital, there's no question that vaccination does the trick. I mean, we saw new data today from the CDC that for people who have been vaccinated and boosted are nearly 100 times less likely to die if they contract COVID than people who are unvaccinated. And they were, again, many times less likely to get hospitalized in the first place if people are vaccinated. So that is the single overriding most important thing they can do, in addition, of course, to continuing to wear masks when indoors in crowded situations.
All right, let's get to a question from a viewer. Ashley asks us, where can I get help for long COVID? My symptoms are headaches and being tired all the time. We hear that a lot, Dr. Koritzkis.
Well, there is now a national effort to be able to gather information about people who have long-term symptoms. And there's a program called the Post-Acute COVID Syndrome, or PACS program. And there are many centers here in Boston, including at the Brigham and Women's Hospital, but also at other hospitals in the city, that are now funded through the National Institutes of Health to be able to answer people's questions, having people come in and get evaluated.
All right, Dr. Koritzkis, we always appreciate your time and your insight. Thank you.
You're very welcome.